Good afternoon, everyone. Thank you for giving me a moment to address the eligibility verification of those that are receiving various forms of Medicaid benefits. And as you know, we have a goal of processing almost 600,000 Medicaid recipients in terms of assuring that they remain qualified and eligible for the Medicaid benefits. Our objective and goal in this effort is to get this right. And part of the overall 600,000 that we're looking at, a part of that or a subset are those that are on the private option. And whether you're for the private option or against the private option, what's important is that we get it right, that those who are on that and receiving those benefits are eligible and remain eligible. And to illustrate the importance of getting this right, I would suspect with 250,000 on the private option, actually it's gone up a little bit more than that. If overall during the next couple of months we determine that 21,000 are ineligible to remain on the private option, that reduction of 21,000 results in over $10 million in savings. And so, and that's per month. And so you can see $10 million per month by a reduction of 21,000 that would be determined to be ineligible for the private option is a significant amount of money. And so you want to get it right for those that remain eligible to make sure that they continue to receive those benefits, but you also want to get this right for the integrity of the program. We're having a debate as to the future of Medicaid reform and where we're going to go in healthcare delivery in Arkansas. And to come to the right conclusion in the future, you want to make sure you get this right and can perform in terms of the eligibility verification, which is an important part of our Medicaid program and its integrity. And so that emphasized the importance of it. What we've been working on day in and day out is the goal of getting it right and assuring that we make the right determination as we review those that are submitting information to assess their eligibility. There's been a question as to whether I made the right judgment call in saying that there should be a 10-day response time to get in information for showing you continue to be eligible. First of all, that notice does only go out to those that are outside of the window, and the data run with Department of Workforce Services show that their income level is beyond the parameters and need to be re-verified. So the 10-day notice is triggered for those that actually need to re-verify their income. The notice that goes out from the Department of Human Services, and this is a sample of it, directs them to submit verification of their income to the Pine Bluff Scanning Center in Pine Bluff, Arkansas. One of the things we realized is that they might send it instead as directed to the Pine Bluff Scanning Center. They might send it to their local DHS office, or they might call in for information and further questions, or they might send it to some other place. But while the 10-day requirement for notice is working very well, the challenge is the capability of DHS to respond to the information overload and the documents that are being sent in. And because we want to make sure that we treat people fairly and we do not wrongfully take someone off the eligibility roll, we are going to pause for 2 weeks any sending out of notices of termination in order to make sure that DHS can catch up with workload in processing the information that has been sent in by the recipients. I think this is fair. I think it's the right thing to do. The challenge is not the 10-day notice requirement. The challenge is processing the information whenever the beneficiary sends in the income verification or the payroll stubs that they have been requested to send in. So we're going to be pausing it for 2 weeks to make sure that the termination notices are not sent out until all of the paperwork can be processed. In addition, we're taking some steps to make sure that we can increase the ability to process the information coming in, and so 20 DHS staff members have been reassigned from other responsibilities to assist in the review of the information. We're redistributing the workload. As I mentioned, the expectation was that all the information would be sent into the Pine Bluff Processing Center. We're having to reallocate resources, staff resources, to some of the more populated locations of DHS and offices because they're having an unexpected challenge. Thirdly, we're asking our DHS workers to engage in overtime, and so we're authorizing overtime in order to more quickly process the information that is sent in. In addition to those steps that DHS is taking, our insurance providers have provided a great deal of assistance in making sure that the insurance beneficiaries are notified to respond quickly to DHS inquiries and to assist them in responding and getting the information in. And so it's important that we do this eligibility redetermination. It is important that we get it right. It is important that we do it both efficiently but also fairly, and that's what our objective is. And until we can be assured that we can send out the right notifications or termination notices, no other termination notice will be sent out until we catch up in the workload. With that, I'll be happy to open it up to questions.
Are you looking at bringing in more employees to DHS, maybe temporarily, or bringing in a vendor?
Yes. We have both contacted a private vendor for enhanced support for the call center. That very well could be cost prohibitive, so we're looking at handling that more in-house. But for example, I've lifted the freeze on 35 employees so they can be immediately filled to enhance the resources that are available. Director Seelig has also talked to Department of Workforce Services for additional staffing support that might be available through that agency. And then finally, we are talking to temporary staffing agencies to provide assistance as well very quickly. So we are looking at those options as well.
What's an estimate of the cost of the additional staffing and processing capabilities?
I don't have a figure for you. The positions that have been reallocated, there will only be minimal costs for that. So there's not really any substantial costs for reallocating 20 employees. In terms of lifting the freeze and immediately filling the positions as soon as we can, of 35 additional positions, those are already budgeted even though they have not been filled. The additional cost for the technology for speeding up the processing of the call centers, that's fairly modest, but that will be an additional cost. So there are some cost elements here. We're measuring step by step as we go along.
What about, I was going to say, what about people that already lost coverage?
Well, it's important to remember that if they're notified that their insurance is terminated, they have a right to submit information, to re-verify their eligibility within 90 days, and if they do that, they're reinstated and it's retroactive. And so that's how the system works. I think that's a fair outcome. If there's some of those that might not receive the notification, they will be reinstated without penalty and retroactive.
I was talking to a lady today, and she went to go get her diabetes medication today, and she couldn't get it. What would you say?
Well, one, maybe...
Considering the backlog, I mean, are people going to be able to get through? I mean, they need their medication now. Like, for them to try to go through the process, won't that take...
Well, the individual in question may not be qualified through income levels for the benefit. And so if they haven't submitted the information, they have not proved their eligibility, then they will have to find a different source for that medication, either private insurance or otherwise. If in fact they remain eligible, they simply need to, after they are alerted by the pharmacy, they get the information in, it's processed, and they are again eligible, and it is retroactive.
I guess what I'm asking is, considering the problems that DHS is having processing these people that are responding to the notifications, why are you not kind of retroactively trying to assess the people that have already lost it, considering you're having so much trouble taking calls and helping people?
Actually, they are. For example, if someone is terminated from the Medicaid rolls, the private option, then they have an opportunity within 90 days to submit information. It will be processed, and if they are in fact eligible, they will be reinstated retroactively.
When you say termination notices, this is different from the verification?
Yes, that is correct. Yes, so one, the verification notice, which is 10 days, only goes to those individuals who, through the data run, show that they are outside the parameters of income to qualify. They are asked to verify their income, to submit information. Once they do that, or if they fail to do that, then they are terminated. And that's where, before we send out that second notice, that termination notice, we want to make sure we've made sure we've processed all the information that might be submitted. And there are some instances that's been drawn to our attention where we haven't had the workers to process that, or it's been sent to the wrong location. We're remedying that. But while we're remedying it, we're pausing the termination notices until we can be sure that we're caught up in the workload.
So you're not pausing the verification?
No. Very important. Very important. We're not pausing the verification requirement. We're not pausing the 10-day requirement. We're not stopping our responsibility for eligibility review.
Can you make the case for why that 10-day window is the appropriate amount of time?
The federal government determined that it should be a minimum of 10-day notice. So I presume from that they believe that 10 days is an adequate notice, even though the states can prolong that. And let me emphasize that adjusting it right now to say 30 days does not solve any problem other than put more money at risk for the state. Because again, the problem is not the notification, the problem is the processing. So let's address the problem, and that is the processing, and we put it on pause until we can get that exactly right. But for example, if we extend it to 30 days, that does not do anything other than slow up the entire process, because even after they have 30 days to respond, and they respond, we still have to process the information. So we're trying to address the problem that is a challenge to the system, and it's not the original verification notice.
I would imagine that a lot of the people who are private option eligible who see a slight boost in income would most likely be eligible for subsidies through the ACA. Are DHS making any effort to notify people of their options as far as signing up for that coverage?
Absolutely. And so if they are in fact terminated, then they are referred to the marketplace to see if they are eligible for subsidies based upon their income level.
How are they referred to that?
That is in the notice, and I'll ask Director Seelig if I'm incorrect, or if you want. Why don't you stand up here, John?
Yes, sir, that's right. It's in the notice that goes to client, and we also send their data to the federal hub, to healthcare.gov. So their information is there, and they still have to take some steps, but we try to go ahead and forward the data already.
You might as well stay handy.
Heather, were you the one who made the 10-day deadline? Was that your call?
Yes, it was. That was recommended by, or I would say DHS discussed that with me. They asked my view on it, and I said, let's do the 10 days.
I don't mean to sound challenging, but don't you throw away letters that look kind of boring and typed up and not really like the first one?
I'm sorry, what?
Don't you throw away letters that look kind of boring and typed up and not very personal?
If I'm a recipient of Medicaid from DHS and I get a letter from DHS, I would presume it'd be a responsibility to open that letter.
John, can you say, what does the envelope look like?
I don't have the envelope with me. I mean, it looks like an envelope coming from a state agency.
Does it say urgent, open now, or does it say anything that would let you know exactly this open?
I don't know what the outside looks like. I will tell you that in general, I mean, we do this with Medicaid clients year in and year out. And in general, when they get something from us, they realize they probably ought to open and look at it. Now, we may have a challenge here because some of these clients, particularly private option clients, have not worked with us before, so it may be more of a challenge for them, I don't know, but it's what we normally would send out.
Is there a possibility that the calls like you're getting for the next 2 weeks, is there a possibility you may, after 2 weeks, look and say it needs to be paused even longer than that?
Well, I've directed Director Seelig to make sure that we are caught up on the processing and we verify that before we reinstate and send out the termination notices. We believe that we can do that within 2 weeks, but we want to make sure that we are caught up whenever we re-engage in sending out the termination notices.
So for people whose coverage is already scheduled to end at the end of this month, would their coverage still terminate?
Well, if it's scheduled to terminate at the end of this month, they either, if they've already received the notice, then that will continue on schedule unless they appealed it or provided additional information. But if they have not submitted their verification information or it's in works, they're not going to get, what is this, August 4th? And so if we pause it for 2 weeks, it still could be terminated by the end of the month. And so it still could be terminated by the end of the month, but we want to make sure we review all the data to make sure they really are not eligible before we make that determination and send out that notice.
So do you think a certain amount of these notices that have already gone out were basically in error? Like people did return the information, but it just hadn't been processed yet because of the lack of staff?
Well, again, we sent out the notice based upon the data run, and then we receive information. You're talking about the first number of terminations. And what's your question in reference to that?
Well, if you're saying there hasn't been enough staff to process the information people are submitting, I'm wondering if some of these notices were actually erroneously sent out, even though people had already sent in the information, but it just hadn't been processed.
Well, what's going to happen is that they're going to go, I mean, one, they might be healthy and not having medical needs, and so they really won't understand that until they go again to a doctor or to a pharmacist and they are denied payment because the insurance has been terminated. At that point, that will trigger their making sure that their information is processed, which we will continue to process. And again, they will be, if they're eligible, they will be reinstated and it will be retroactive. And so the pharmacy will get the payment for the drug that is needed.
I'm just wondering if you think that the backlog in processing applications has resulted in people erroneously, being terminated when they actually did submit the information, but it just hadn't been processed in time.
There is some anecdotal information to that effect. So I've been contacted. That's one of the reasons we are pausing the termination notices, because we got to catch the backlog up, and there is some instances of that, and we certainly don't want that to happen.
And for those people, what would you recommend that they do? Is there someone they can contact?
Well, we're working through that. One, the question is, do they know it? And obviously, if they're going to go to a pharmacist and they're denied, and one, you've got to remember that they might not be eligible. So they might not be able to be reinstated because they are not eligible. If they believe they are eligible and they have submitted the pay stubs, then we have got to process that, and we will be doing that very quickly, and they'll be reinstated. So hopefully it'll be a very short amount of time. All right, thank you all very much.